Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Nifedipine, or Adalat as a brand name. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, not to be used as a source for recommendations for your personal health care. In this video, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to use Nifedipine. We'll then touch on examples of dosing for different conditions, then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Nifedipine is a slow calcium channel antagonist. It selectively inhibits the transmembrane influx of calcium into cardiac muscle and vascular smooth muscle. It causes arterial vasodilation, which produces a reduction in peripheral vascular resistance. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in hypertension or high blood pressure, as well as coronary artery spasm, or in the treatment of chronic stable angina or chest pain. With respect to contraindications or reasons we would not be able to use Nifedipine in a patient, we wouldn't give it to a patient who is experiencing cardiogenic shock, or a patient who is using strong CYP450 inducers. An example of this would be the medication rifampin. If a patient had a hypersensitivity to Nifedipine or any other component of the formulation, they would also not use this medication in that scenario. Now for some examples of dosing with Nifedipine. So in the treatment of hypertension or high blood pressure, using the extended release formulation, the initial dose would be 30 milligrams once daily on an empty stomach. You would then titrate or increase the dose over 7 to 14 days to a maintenance dose of 30 to 60 milligrams once daily. The maximum dose, again for the extended release formulation, would be 90 milligrams daily. In the treatment of chronic stable angina, now using the immediate release formulation, the initial dose would be 10 milligrams orally 3 times daily, with a maintenance dose of 10 to 30 milligrams 3 or 4 times daily, and the maximum here, again for the immediate release formulation, would be 180 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Nifedipine. We'll go over some of those here now. 4 to 10% of patients may experience dizziness, while 4 to 25% may experience flushing. 10% of patients may experience nausea, and a headache may occur in 19 to 23% of patients. Hypotension or low blood pressure seems to happen about 5% of the time, and palpitations may happen 7% of the time. 7 to 29% of patients may experience peripheral edema. Some other common side effects may be cough, dyspnea or difficulty breathing, as well as nervousness. Now, 2 serious side effects would be a myocardial infarction or ventricular arrhythmia. Alright everybody, that's all we're going to talk about today with Nifedipine or Adalat. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.